name is Mike Kavnar. I'm a surgical oncologist here at UK. I focus mostly on gastrointestinal oncology cancers. So those are cancers within the abdomen, typically within the liver, pancreas, stomach, or small intestine. These type of cancers are often very complicated. A patient may show up to my office with 300 pages of records and may have dozens of CT scans and MRIs that have been done. They may have received multiple biopsies or treatments or different kinds of chemotherapy. And the only way you can know if our potential treatments are going to benefit that patient is if you understand everything that's happened to that patient and you carefully think about all of the different steps of that. And for one patient, that may involve making 10 different phone calls and looking at multiple different scans, discussing with different colleagues. And the devil is in the details. And if you don't get the details right, you really can't properly take care of these complicated patients. At a program like this, we have really all of the different elements that are needed. So not only do you need a good surgeon who has all of the appropriate training, but you need interventional radiology, gastroenterology, very high-level pathology, radiology, the list goes on and on. Pharmacy, you hear UK pharmacy is very strong, and all of those different elements are here at a big academic institution like UK are the top of the line. On top of that, we have a very strong teaching program where we have residents and fellows that are being trained in this, but which is an important part of the academic mission. But they're highly involved in this care and really help take care of our complicated patients. When we see a patient, we're faced with the question of not only can I do the surgery technically, the answer is often yes, but the question of should I do that surgery biologically? Will removal of this tumor help this patient live longer or feel better? And sometimes the answer is no, and that comes down to the biology part. And so I've always been very interested in science and biology. I was actually drawn into medicine by my AP biology teacher in high school, and that sort of got the part started. I was always very curious about science and biology. And so I really enjoy that part of the job, which is understanding the difference between, for example, a pancreatic neuroendocrine tumor, which is typically a very indolent disease, and pancreatic cancer, which is a very aggressive disease and needs a very different treatment. If you take a patient through a really incredibly complex, long treatment pathway and you get to the end of that and you've got that patient free of disease and you can give them a hug and smile with them and be happy with them about that, that is one of the most satisfying things in the world. We get some wins like that, and those are awesome. And we don't always get that, but even just the process of guiding a cancer patient through this suffering, this horrible thing that's happened to them, even if it means we can't cure them, we help them understand what's going on. We help them get the right treatment. Sometimes it's even just get the diagnosis. They don't know what's going on yet, but get the right treatment and help them live the longest they can, but also the best quality of life they can.